Good morning. Today's lecture for the practical surgery is about the introduction to surgical theater and the preparation of surgical packs. This lecture will be divided into 4 stages. إلى 4 مراحل سوف يتم تقسيمها: preparation of surgical packs or surgical drum, surgical theater, what you should have get in surgical theater and the pre-operative room, and the third part is about the preparations of patients, your patients اللي هي الحيوان اللي انت ناوي تعمل له العملية. And the final part of this lecture will be about the preparation of surgical team. هذا which include the surgeons and surgical staff within the operation. First of all, as I said, we have the preparation of surgical pack. Surgical pack, you already had it, supposed to have it in theoretical lecture with Dr. Sarwa previously. So it's a piece of material that has special character, which include inside the surgical instrument, the surgical drapes, hand towel possible, and possible gauze. So if you have more than one option for the surgical pack. It's either you'll get it as a package, as a material, or you can have it as a material and you then put it in a surgical drum, which is a metal box, cylinder, mostly cylinder like shape, has windows. When you prepare the surgical drum, you will take it to sterilization unit for sterilization, and this kind of a drum, I'll show you later on, has windows which have to be opened during the sterilization stage, and after finishing sterilization you have to shut them down, to close them, all of these windows. So this will indicate that the surgical drum is sterile and ready to be used. As I said, the surgical pack or surgical drum essentially has to have surgical drapes, hand towels, and gauze. From the most base to the most to the apex or most superficial layer of that pack, it should include at the base the instruments, and you have to organize these instruments based. The organization has more than one opinion. It's either you organize them according to what is more essential for you. It's possibly organized based on the size, which is more common, with keeping in your mind يعني تخلي بحساباتك إنه تكون كل مجموعة تكون متتالية لمجموعة أخرى. يعني مثلا hemostatic artery forceps followed by needle holders, and then by scissors, and finally by towel clips or towel forceps. So the instruments, the organizing of it has more than one option. However, you have to keep in your mind a minimum while you organize your instruments. They have to have mostly the towel clips or towel forceps at the end. Whenever you open the hanger, you will see at the beginning these clips, so they are ready for to be used in draping. Then the second part, which is also essential, however, for instruments they are usually metal, so they are reusable for sterilization. Surgical drape, hand towels, gauze, possibly reusable, and sometimes they are nowadays nowadays surgeons and surgical theater teams, they move to use a disposable kind of surgical drapes, surgical hand towels, and gauze, because this will decrease the possibility of contamination. So they will receive it directly, sterile, and they are for a single use. So for surgical drapes, as I said, you must have a minimum for drapes smaller size than the laboratory sheet, which has a larger size, approximately has a width 1 meter by 1 or even more than this. So when you drape the four drapes, by the way, you have to keep them organized alternatively بطريقة أخرى، إنه تضعها كما سيوضح لاحقا، يتم وضعها بطريقة متبادلة، يعني مثلا من الجهة اليمنى ثم تأتي الجهة اليسرى أعلى منها، ثم الجهة المقابلة للجهة الأولى اللي تم إجراء الدريبنج راح تصير بطريقة أعلى من سابقتها، وهكذا، وبالتالي يتم تثبيتها بالتاول كليبس. ويجب أن حين يثبت التاول كليبس يجب أن يأخذ جزء من السكن مع two of the drapes of each drapes, 4 drapes. بعد ما يتم وضعهم بشكل منظم يتم وضع اللابراتوري شيت، وعادة هذا اللي يكون حجمه كبير، فيفضل أنه يكون بمساعدة second surgeon, as I'll show you later on. For hand towels, they are 2 pieces of materials, smaller size. It's either disposable or reusable. You will use them if you want to dry your hand from alcohol, the second process after you scrub your hands and arms for sterilization, for preparation, surgical preparation. Then the gauze, gauze usually in each drum or pack, each one has to have, if you decided to go through a reusable kind of materials, gauze, hand towel, surgical drape, so the gauze has to be 2 a minimum, as the surgeon and the assisted surgeon as well, or second surgeon at the same time. Again, as I said before, for the hand towels and surgical drape, you possibly use a non or disposable kind of gauze, so you will use them for a single dose, and in this situation possibly your pack or your drum will have only a surgical instruments without the rest.